Today I will be demonstrating my skill in wound assessment and dry gauze dressing change. So verify your physician's orders. So for Mr. Mancini, the orders are to clean wound with normal saline 2 times a day and to apply a dry gauze dressing. Perform hand hygiene. And then go introduce yourself to the patient and explain the procedure. Hello, today my name is Victoria. I'm an L2 COMAC nursing student and I will be doing your wound dressing change today. So before we begin, can you tell me your name and your birthday? And then I will also check his hospital wristband as the second identifier. And since they all match, we will continue. So assess your patient's pain scale before you begin your procedure. So Mario, can you tell me if you're feeling any pain today on a scale of 0 to 10, what would you rate it? So Mario, today we're going to be changing your wound dressing. So I'm going to remove your old dressing, assess your wound, make sure everything's going okay, and then if there's no complications, I'm going to redress your wound, and hopefully there'll be no pain today. Perform hand hygiene. So we're going to be creating a sterile field with this outside cloth, so I'm only touching the outward inch of the cloth to keep it all nice and clean. Pouring some saline solution in the container. I'm going to open the lid and pour some saline solution into the container. I will then perform hand hygiene. And putting on my gloves. Begin by removing the previous dressing. And throwing out the dressing and your gloves. Perform hand hygiene and assess the wound. For an adequate wound assessment, you want to be checking the wound. Is it open? Is it closed? Is it acute or is it chronic? So when assessing your wounds, remember that there are 7 different types of wounds. There is a contusion, which is a bruising of the skin, and that can be caused by a blow to the body. There is an abrasion, and that's a scraping or rubbing of the skin surfaces. There's an incision, which is a cut on skin created by a sharp instrument. And there's a laceration, which is a tearing of tissues with irregular wound edges. There's also puncture, which is entry to skin and underlying tissues by a sharp object. Penetrating, which is piercing of the skin. And there's also an ulcer, which is a break in the skin with a loss of surface tissue. The 3 types of wound healing is primary, which is that the wound is closed, such as with staples. There is secondary, where the wound had significant tissue loss, and then there's tertiary, where the wound is kept open for purposeful reasons, such as to continue drainage. 3 types of wound complications that may occur would be infection, and signs of this would be inflammation, redness, a delay in wound healing, or edema. There can also be a hemorrhage. And this is when it is caused internally or externally, and it can occur after hemostasis. There's also evisceration, and this there's a protrusion of the visceral organs from the wound opening, and that requires an emergency surgery. 3 factors that may affect wound healing could include obesity, because the fatty tissues lack adequate oxygenation, which can affect wound healing. Vascular diseases, because it affects circulation and the ability for oxygenated blood to get to the wound. And another one would be malnutrition, and that can slow down wound healing. So there's 4 different types of wound drainage, and that would be purulent, serous, serosanguinous, and sanguinous. Perform hand hygiene. And don gloves. Next, I'm going to clean the wound, going from the internal part of the wound outwards so that I do not bring dirt into the wound. So I'm going to use my tweezers and do into a little bowl. And go from the inside out. And continue this until the entire wound is clean. Next, you want to dry the wound with gauze. Also going from the inside out until the entire wound is dry. Finish by applying a new dry gauze dressing. So you want to pull the gauze dressing out of the package, place it over the wound, and secure with tape. So perform hand hygiene and dispose of supplies in the appropriate containers. The signs of adequate wound healing is that there is no drainage, no pain, no redness, no inflammation, and that there is signs of new tissue growth. To document the wound afterwards, you need to document the appearance of the wound, the color of the wound, the drainage, the depth of the wound, and the size.